Assalamualaikum and hi. For our presentation, we have choose bio case study number 7, which is about type 1 diabetes. Here is our team members who involved in the presentation. So here is our question based on topic 7. Type 1 diabetes, also known as diabetes mellitus, is an autoimmune disease in which immune cells attack and destroy the insulin-producing cells of the pancreas. The loss of insulin leads to the inability to regulate blood sugar levels. Patients are usually treated by insulin replacement therapy. Describe this practice. Recommend intervention could be taken towards kids and adolescents to prevent the disease. First of all, what is diabetes mellitus? Type 1 diabetes mellitus is an autoimmune disease that leads to body failure in producing insulin by beta cells located in the pancreas. This might happen in the body for months or years before any symptoms appear. The body's own immune system, which normally destroys harmful bacteria and viruses, contrarily for diabetic patients, the immune system attacks islet insulin-producing cells. The main cause for this remains unknown, but the patients may be affected by the disease through genetics. Type 1 diabetes usually diagnosed more often in children or young adults. So, what is the importance of insulin? Insulin is a hormone secreted that aids in sugar movement from blood to the body cells. This is how insulin decreases sugar content in the blood. Cells in the blood need sugar for energy. The sugar level goes up when the sugar being stuck in the blood or when they are not transported to the cells. High blood sugar can cause the buildup of fatty materials to the walls of blood vessels. Eventually, the blood vessels become narrow and will slow down the transportation of blood to the body cells. The buildup of fatty materials is the reason why diabetes is most commonly related to other diseases as well. Failure in insulin production can cause other disease related to diabetes. Diabetes, the incurable disease that creates excess sugar in the bloodstream, associates with heart disease. People with heart disease has atherosclerosis, which is the build-up of plaque in the walls of arteries that hampering the blood flow. Plaque is formed by the combination of cholesterol with other materials like fats, calcium. Poor circulation of blood to the heart cause heart attack, chest pain, or angina. Another alarming fact is that if the cholesterol plaque break apart or rupture, the body will seal the plaque with platelets to repair the rupture. Those tiny platelets help your body to stop bleeding. However, the artery is small, the gathered platelets carry the risk of blocked blood flow, not allowing the oxygen delivery, and heart attack develops. This process can happen not only in the arteries but also resulting in lack of blood to the brain, causing a stroke, or lack of blood to the arms, hands, and feet, causing peripheral arterial disease. The purpose of insulin therapy is to control blood sugar levels and to
My name is Shasha Shafiah binti Khairuddin. My student ID is 2022-878474. Type 1 diabetes is an autoimmune disease. The body's immune system attacks the cells that make insulin. As a result, the body makes very little insulin or no insulin. Type 1 diabetes is also called insulin-dependent diabetes. It often happens at a younger age. It often starts before age 30. Treatment for type 1 diabetes include getting daily multiple injections of insulin or using an insulin pen or pump. An inhaled insulin is available but isn't used as often. A pill form of insulin is being developed and may be available in the near future. Okay, there is many types of insulin devices are available, but for type 1 diabetes, it uses insulin pen and external insulin pump. So here is the diagram of insulin pen and the external insulin pump. An insulin pen is like a preloaded syringe that can be used multiple times. It is often used for multiple daily doses of insulin. The insulin pen holds a cartridge with insulin. The pen looks like a writing pen. It has a small needle that can be screwed on at the tip. A dial on the pen lets you set the right dose. A plunger on the other end of the pen is used to actually deliver or inject the insulin. Okay, the next one is the insulin pump. An insulin pump is a device that pumps insulin continuously through plastic tubing. The tubing is attached to a needle under the skin near the belly. It can also be used to inject a single large dose bolus of insulin as needed. The pump is small enough to be worn on a belt or in a pocket. Insulin needs to enter the body's bloodstreams to work. At this time, insulin must be given by injection. It should not be taken by mouth because it breaks down in the stomach during digestion. An oral form that can pass through the stomach is also being developed, but for now, to get it into the blood, it must be injected into the fat layer under the skin. This is often done on the arms, thigh, or abdomen. Different sites on the body allow insulin to enter the blood at different rates. Insulin that injected into the stomach wall works the fastest. Injecting it into the thigh works the slowest. Okay, the timing of insulin injections is very important. Okay, for the first one, rapid-acting and short-acting insulin. This usually needs to be given before meals or before sugar from a meal starts to enter the bloodstreams. Second, intermediate-acting insulin or mixed insulin. This needs to be taken at the same time every day along with a fixed eating schedule. For the last one is a long-acting insulin. This should be taken at the same time every day, but your meal times can be flexible. Okay, here is the type of timing of insulin. So the first one is onset. Onset is defined how quickly insulin begins to work after it is injected. The second one is peak time. Peak time is the period of time when insulin helps the most to lower blood sugar levels. And the last one is duration. Duration is how long insulin continues to work in the body. Okay, this table is a brief explanation of how the type of insulin works in a period of time.
My name is Nurina Huda binti Ahmad Syafiq. My student ID is 2022807962. I will explain about intervention in diabetes type 1. The first is education. We must educate people to understand and support government's policy in healthcare system. Nowadays, there's been talk about the government wanting to develop a new type of early exposure of this type 1 diabetes. They plan to include and normalize getting children, especially babies, checked for any symptoms of type 1 diabetes regularly in clinics. Next is diet. Learn how to count the amount of carbohydrates in the foods you eat. By doing so, you can give yourself enough insulin. This will allow your body to properly use those carbohydrates. A registered dietitian can help you create a meal plan that fits your needs. Next is physical activities. Physical activities lowers blood sugar. So you can choose any type of activities you enjoy, such as walking or swimming, and do them every day or whenever you can. Everyone needs regular aerobic exercise, including people who have type 1 diabetes. Remember that physical activity lowers blood sugar. So if you begin a new activity, check your blood sugar level more often than usual until you know how that activity affects your blood sugar levels. You might need to adjust your meal plan or insulin doses because of the increased activity. The last one is monitor your blood sugar levels. So, depending on the type of insulin therapy you select or need, you may have to check and record your blood sugar levels at least 4 times a day. Even if you take insulin or eat on a tight schedule, blood sugar levels still can change. You will learn how your blood sugar level changes in response to food, activity, illness, medication, stress, hormonal changes, and alcohol. The American Diabetes Association recommends testing blood sugar levels before meals and snacks, before bed, before exercising or driving, and whenever you think you have low blood sugar. careful monitoring is the only way to make sure that your blood sugar level remains within your target range. More frequent monitoring can lower your A1C levels.